Pearl. Good morning, and thank you for joining us in our third and final webinar presentation. Our webinar today will focus on meaningful use measures and how partnering with Ashline can assist you in meeting your measures. My name is Connie Diaz, and I am the Central Arizona Referral Development Coordinator for Healthcare Facilities in Arizona. I cover the counties of Maricopa and La Paz. And briefly, I do have a disclosure statement that I will review. Neither the Arizona Smokers Helpline have any affiliation or financial relationships with any organization or entity with a financial interest in or financial competition with the subject matter or materials discussed in this presentation. In today's webinar, I will give an overview of meaningful use. I will discuss what criteria are necessary for meaningful use and look at the quality measures that a facility must encompass to qualify for meaningful use. We will cover eligibility for incentive payments and lastly walk through specific examples of how Ashline can assist you in meeting the tobacco core measure as well as other quality measures that are required for EHR incentive payments. Our mission at Ashline, I went one too far. At Ashline, our mission is to improve the health of Arizonans by providing client-centered tobacco cessation services through technology-based interventions. And let's begin by reviewing the definition of meaningful use. The American Recovery and Reinvestment Act of 2009 specifies three main components of meaningful use: the use of a certified electronic health record, or EHR, in a meaningful manner, the use of certified EHR technology for electronic exchange of health information to improve quality of health care, and lastly, the use of certified EHR technology to submit clinical quality and other measures. So simply put, meaningful use means that providers and hospitals need to show that they are using certified EHR technology in ways that can be measured significantly in quality and in quantity. Participation in meaningful use will allow the provider, the hospital, and the patient improved communication and information. It will allow for complete and accurate information. With electronic health records, providers have the information they need to provide the best possible care, and providers will know more about their patients and their health history before they walk into the examination room. It will also allow for better access to information. Electronic health records facilitate greater access to the information that providers need to diagnose health problems earlier and to improve health outcomes of their patients. Electronic health records also allow information to be shared more easily among doctors' offices, hospitals, and across health systems and community programs such as Ashline, leading to better coordination of care. And lastly, it will also lead to patient empowerment. Electronic health records will help empower patients to take a more active role in their health and in the health of their families. The criteria for meaningful use will be staged in 3 steps over the course of the next 5 years. Stage 1, which is in 2011 and 2012, sets the baseline for electronic data capture and information sharing. Step 2, expected to be implemented in 2013, and then Stage 3, expected to be implemented in 2015, will continue to expand on this baseline and be developed through future rulemaking. Providers participating in the Medicaid EHR incentive program can register for CMS now if they've not already registered, and registration for Arizona's Access Incentive Program opened on July 25th of this year, and attestation for Access begins on September 1st. There are 2 incentive programs, the Medicare and the Medicaid payment program. Medicare is federally administered by CMS, while Medicaid is administered voluntarily by states. Eligible professionals must choose between the Medicare and the Medicaid EHR incentive program when they register, while hospitals can apply for both. So to be eligible for the Medicare EHR incentive program, eligible professionals, hospitals, and critical access hospitals, or CAHs, must successfully demonstrate meaningful use of certified electronic health record technology every year that they participate in the program. Medicaid EHR incentive program, eligible professionals and hospitals may qualify for incentive payments if they adopt, implement, upgrade, or demonstrate meaningful use in their first year of participation and in subsequent participation years. So in order for a facility to be eligible for EHR meaningful use participation, they must meet the following definition. First, they must have adopted a system, which means they've acquired and installed certified EHR technology and can show evidence of installation. Second, they must have implemented the system. They've begun using the certified EHR technology, for example, provided staff training or data entry of patient demographic information in the EHR. And lastly, they may have upgraded the system, which means they've expanded existing technology to meet certification requirements. For example, they've upgraded to a certified technology or added new functionality to meet the definition of certified EHR technology. So to review, Medicare and Medicaid EHR incentive programs will provide incentive payments to eligible professionals, hospitals, and critical access hospitals as they adopt, implement, upgrade, or demonstrate meaningful use EHR technology. In Arizona, Access will administer the incentive payments to eligible professionals and eligible hospitals. They will conduct adequate oversight of the program, including tracking meaningful use, and also encourage the adoption of certified EHR technology and provide leadership for Medicaid stakeholders. How much is available through Access? Here in Arizona, Arizona could receive as much as $500 million, $300 million for eligible hospitals, and $200 million for eligible professionals. Let's review who the eligible professionals are under Medicaid. So under the Medicaid EHR incentive program, this includes doctor of medicine or osteopathy, nurse practitioner, certified nurse midwife, dentist, or physician assistant. And note that for a physician assistant, the physician assistant must be one who furnishes services in a federally qualified health center or a rural health clinic that is led by that physician assistant. For eligible professionals under the Medicare EHR incentive program, eligible professionals are doctor of medicine or osteopathy, doctor of dental surgery or dental medicine, doctor of podiatry, doctor of optometry, and chiropractor. And again, eligible professionals are eligible for both the Medicare and the Medicaid EHR incentive program, but they must choose which program they wish to participate in when they register. Before 2015, an eligible professional may switch programs only once after they received their first incentive payment. Most eligible professionals will maximize their incentive payments by participating in the Medicaid EHR incentive program. Moving on to eligible hospitals and what the qualifications are for eligibility. For an eligible hospital under the Medicare EHR incentive program, this includes subsection D hospitals in the 50 states or DC that are paid under the Inpatient Prospective Payment System, or IPPS, critical access hospitals, CAHs, or Medicare Advantage MA affiliated hospitals. And on a side note, a critical access hospital is a rural primary health hospital that gives limited in- or outpatient services to people in rural areas. Now, eligible hospitals under the Medicaid EHR program are acute care hospitals, including CAHs, and cancer hospitals with at least 10% Medicaid patient volume. And also children's hospitals, there's no Medicaid patient volume requirement for the children's hospital. So again, to review the eligibility for hospitals, hospitals are eligible for both programs, and hospitals that are eligible for EHR incentive payments must select both Medicare and Medicaid during the registration process, even if they plan to apply only for Medicaid EHR incentive payments by adopting, implementing, or upgrading their certified EHR technology. To demonstrate meaningful use successfully, eligible professionals, hospitals, and CAHs are required to report clinical quality measures that are specific to eligible professionals or hospitals and CAHs. So let's take a look at the eligible professional. They must report on 15 core measures, 5 of 10 menu set measures, and 6 clinical quality measures. For an eligible hospital, the eligible hospital must report on 14 core measures, 5 objectives of 10 from the menu set, and 15 clinical quality measures. For a listing of all the quality measures, I have listed the CMS websites for Medicare and Medicaid, where you can find a complete list of all 25 measures that an eligible professional or an eligible hospital must meet. We've also made these available in our PDF handouts in these handout sections that Abel described earlier. For the remainder of this webinar, I will focus specifically on measures that can be met by establishing a pathway in your EHR to Ashline, and will show how the Ask, Advise, Refer model can achieve this process. So for an eligible provider that's partnering with Ashline, the provider core measures that can be met would be provider core measure number 9, which states record smoking status for patients 13 or older. Provider core measure number 10, report ambulatory clinical quality to CMS and the state, and this includes tobacco. And provider core measure number 11, implement on a clinical decision support rule. And a brief definition of ambulatory clinical quality and clinical decision support rule. For ambulatory clinical quality, what that means is that in order to report clinical quality measures from an electronic health record, electronic specifications must be developed that include data elements, logic, and definition for that measure in a format that can be captured and stored so that data can be sent or shared electronically. So in this case, a referral to Ashline would meet that requirement. Clinical decision support rule is a process for enhancing health-related decisions and actions with pertinent, organized clinical knowledge and patient information to improve health and healthcare delivery. So information can be included to patients, clinicians, and others involved in patient care delivery, such as tobacco cessation services to Ashline. So again, for the providers partnering with Ashline, the provider menu set. For the menu set, providers must choose 5 of 10 measures. So the menu sets that are measured with partnering with Ashline would be provider menu set number 3, generate a list of patients by specific conditions, in this case tobacco. Provider menu set number 6, use certified EHR technology to identify patient-specific education resources and provide to patient if appropriate. So for example, a referral to Ashline would meet this requirement. For the clinical quality measures, providers must choose 6 measures in the clinical quality measure group. And provider quality measure number 28, which states preventive care and screening, also includes the percentage of patients aged 18 years or older who have been seen for at least 2 office visits, who are queried about tobacco use 1 or more times within 24 months. And the rationale for this being included into this clinical quality measure is that tobacco use is one of the leading causes of preventable diseases. However, not all individuals are screened for tobacco use. So it is strongly recommended that clinicians screen all adults for tobacco use and provide tobacco cessation interventions for those who use tobacco products. For a hospital partnering with Ashline, the following measures may be met. Hospital core measure number 8, again similar to the provider, which is record smoking status for patients 13 or older. Hospital core measure number 10, implement on a clinical decision support rule. And hospital core measure number 13, the capability to exchange key clinical information among providers of care and patient authorized entities electronically. So again, a referral to Ashline would meet this core measure. By creating a workflow to Ashline into the EHR, also menu set number 4 and menu set number 5 could be met. Menu set number 4 states generate a list of patients by specific conditions. Again, tobacco would be this example. And hospital menu set number 5, the use of certified EHR technology to identify patient-specific education resources and provide to patient if appropriate. So tobacco cessation education materials as well as a referral to Ashline would fall into menu set number 5. By implementing the U.S. Public Health Service Clinical Practice Guidelines of Ask, Advise, Refer, these measures can be met by eligible professionals and eligible hospitals when patients are referred to Ashline. We recommend implementing Ask, Advise, Refer within your electronic health record system as a tool to meet the measures that we just reviewed. I will take the Ask, Advise, Refer model in the next few slides and share specific examples of various EHR systems and how they've implemented this model and can meet the measures. So the first example we're going to look at is the clinical measure of ASK. Every patient over age 13 should be screened for tobacco use status. Additional measures that are met, this is core measure number 9, and additional measures that are met here are measure set number 10 and eligible hospital core measure number 8. So let's take a look at this first example. In this example, the information is collected during intake. So we see here that the patient has come to this particular location, and during the intake, we're going to collect height, we're going to collect weight, temperature, pulse, and then in this next screen, we're going to see tobacco use. So we're collecting right up off the bat, is a person a current tobacco user, a previous tobacco, or has never used tobacco. Over to the right-hand side, there's also a section for an individual to enter information that they've demonstrated counseling. Again, still on clinical measure number 1, example number 2, still meeting the patient over 13 should be screened for tobacco use, but we're also meeting in this particular example menu set number 3 and menu set number 4, which is generate a list of conditions for patients. So taking a look at this example, this EHR has established tobacco use of the patient. So over on our right-hand side, we see the assessment in red. It says may be a current smoker, last counsel date 12/19 of 06. In the center, under the problem list, we're also seeing smoking related and smoking under the problems checked. At the top of this EHR example, we've notified the provider again in a red flag or a red cigarette and a red star that this individual may be a tobacco user, was a tobacco the last time they came into the office. We're taking a look over to the left-hand side, smoking cessation medication. So it offers the provider a list of medications that were tried possibly. And on the left-hand side again, orders for tobacco counseling were checked by the provider. So here it says email tobacco counselor, and we see in this particular example that it was checked. I also want to go through some of the other options that are part of this screen. Also, we see that patient is advised to quit, discuss barriers and reasons to quit, and offer help when ready to quit. Encourage patient to quit in the next 30 days. Patient was offered cessation referral but declined. Patient was offered cessation meds but declined. Spent 3 minutes discussing cessation options. And print QuitWorks referral form, again in Spanish, and then also tips for the smoker that can be printed while the patient is in the office. There's also information here that can assist the provider where it says start a nicotine replacement, help me choose. So this particular example encompasses a great amount of tools and information that can assist the provider in helping the patient to get to tobacco cessation services and also helping them with their quit attempt. The next clinical practice guideline is practice guideline number 2, which is advise. And in the advice portion, we meet the use of certified EHR technology to identify patient-specific education resources and provide to patient if appropriate, which is menu set number 6 also and menu set number 5. So taking a look at the previous screen that we had seen where the patient was at intake was given the intake and asked about tobacco. This patient was asked about tobacco status, and then during this step, the advice portion, the tobacco use is quantified. So here we asked about tobacco use. This person is currently smoking. When this section is clicked of smoking now, we're going to get this pop-up window, and now we see the details for smoking now. And the next thing we want to do is quantify how much is the patient smoking, what type of tobacco is the patient using. So here we see smoking. We can put in how many cigarettes a day, how many packs a day, smoking cigarettes for how many years. We also have the option of cigars or smoking pipe. If you look over to the left, another option that was available would be chewing tobacco, and a different screen would pop up and give you pretty much the same information for the patient to have a referral to Ashline. After the patient has been quantified their tobacco, we're still under the advice portion. Here's where we're asking the patient, are you interested in quitting? In this particular example, the patient says, yes, I'm interested in quitting. After clicking the yes, we're going to get the details and the information that's available for the medical staff to assist the patient in getting a referral to Ashline and education for tobacco cessation. So the options that pop up in this detail are referral to Ashline, Ashline brochure given, and discussion with a provider. And note that all three can be checked, and we know that multiple interventions with a tobacco user increases the success rate. So all of these three can be done at the same time so that you're offering multiple interventions for this patient. In this particular example, the patient is not interested, and information and education can still be given. So patient comes in, patient is not interested in quitting. We've assessed them about tobacco use. Currently smoking, patient says not currently interested. We click on the no button and the details for no appear here. The options that can be given for an individual patient that is not ready to quit, we can still give education, share the Ashline brochure in case the patient decides I may want to make a quit attempt and give them a call after I leave the office. And also a discussion with the provider is an option. And hopefully the discussion with the provider will increase the patient's desire to quit and maybe more likely to make a quit attempt. And then the final step of the clinical practice guideline recommendation is refer. And we're meeting the use of certified EHR technology to link patients interested in quitting with resources to quit. The measures that are met are core measure number 11, eligible professional menu set 6, eligible professional the clinical quality measure 28, and hospital core measure number 10 and 13. In the final step, again, once the patient has expressed interest in quitting and has been offered cessation services, a referral form can be queried on your EHR. This example captures all of the necessary information for Ashline to receive your referral and to contact your patients within 24 hours of receiving that referral. So again, we're going to take a look over at the top. We see the order entry has been an Ashline referral in this particular electronic medical record. The details of the order, what language does the patient prefer to speak in, English in this particular case, the best time for Ashline to call the patient, verbal consent has been given, yes, and down at the bottom under patient instruction, we see that verbal consent was given and the patient was read the consent that's necessary for a patient to receive services through Ashline. And then lastly, we're going to save and return. By saving and returning, this particular order will come to Ashline and will become part of our queue to call. and the patient will then be called within 24 hours. And beginning in 2011, eligible professionals will need to attest that they are collecting data for tobacco cessation measures if they choose to report measures from primary care or the pulmonology measure group, and eventually they will need to submit clinical data for these measures. We at Ashline can help. We can offer assistance with both policy and workflow development. We have experience assisting health professionals and organizations with systems change, including implementation of tobacco treatment workflow. We have customized training available. We can take the Ask, Advise, Refer and work with your EHR to customize it to your system. Also, the system summary referral reports, which detail the number of referrals submitted by each site within your organization for a specified period of time, whether it be monthly, quarterly, or annually, and our enrollment reports, which detail the number of conversions from a referral to enrollment in Ashline services for your organization for a specified period of time. These reports are available, and they may assist you in providing data to both CMS and Access as proof of data submission via your EHR. We do have a referral development staff who specializes in assisting both medical and behavioral health practitioners and facilities. If you have any questions or would like assistance in developing a quit tobacco workflow, contact your regional referral development coordinator. And our medical outreach staff for the Central Arizona area is myself. I'm the referral development coordinator covering Maricopa and La Paz County. Jennifer Hernandez is our Northern Arizona Referral Development Coordinator, and Ryan Rykowski is our Southern Arizona Referral Development Coordinator. For our behavioral health staff, Karen Aiken is our Central Arizona Referral Development Coordinator, and Shannon Vothis is our Southern Arizona Referral Development Coordinator. I have listed useful websites to assist you in gathering more information on meaningful use. The first is the Centers for Medicare and Medicaid Services. The second is the Arizona Healthy Connection. They have a wealth of information for the State Access Program. And then lastly, the Office of National Coordinator for Health Information and Technology. And in order to improve our services and information we develop for healthcare providers, we would love to get your feedback. After the webinar today, we will be sending you a short feedback form via email. Please take a moment to provide us with your thoughts on today's Meaningful Use webinar. Thank you.